Hi, my name's Cameron. I'm a physical therapist, and today we're going to talk about a few simple exercises you can do after knee surgeries to help get back your motion and your strength. As a physical therapist, one of the main things that we're concerned about after your knee surgery is number one, getting back your range of motion. That includes your extension, which is being able to get the knee all the way straight, and that also includes your flexion, or being able to bend your knee. So we're going to start with a few simple extension exercises to help get your knee all the way straight after surgery. The first exercise is really not much of an exercise. You're going to be letting gravity do most of the work. With Wade right here, he had a left knee surgery and he's having some difficulty getting his leg all the way straight. One thing you can do is take a bolster if you have it. If you don't have it, you don't need any special equipment. You can use a towel roll, a pillow, or anything. Prop up your heel on this bolster here. And what that's going to do is you're going to let this muscle relax and just let gravity push the knee all the way down. Okay. Some things that you want to watch for on this are making sure that you keep the knee straight and also the toe straight, pointing up towards the ceiling. Because if you let the leg roll out to the side like this, the knee's going to stay bent. Even though you may think you're doing a stretch, it's not going to be stretching the knee for you. Getting your knee straight or your extension back after surgery is very, very important, because if you don't get it back, you're going to walk with a limp, and the longer it goes after your surgery, before you have full motion, the harder and harder it is to get back. The next exercise we're going to work on straightening is using here we have a resistance band, but you don't necessarily have to use a resistance band. You can even use something as simple as a towel. But this is a simple calf stretch that's going to stretch the muscles, primarily the hamstring and your calf muscles on the back of your leg that can get tight after surgery and prevent that leg from getting all the way straight. So I'm going to wrap this around the ball of your foot here. And Wade, I'm going to have you sit up if you can. Okay. You're going to go ahead and hold on to this band. You're going to put this right around the ball of your foot. You're going to relax the leg, and you're just going to lean back till you feel a stretch and you feel that pull across the back of your leg. And again, this is going to be stretching these muscles on the back side of your leg that can get tight after surgery and prevent that knee from going all the way straight. So with these, you want to hold them for about 30 seconds and repeat about 5 times. The next exercise we're going to work on is our bending motion, and we'll call that flexion, but flexion and bending mean the same thing. So I'm going to have you go ahead and lay back down, Wade. Okay, the first exercise is just a real simple heel slide, and all that entails is you're just going to be bending the knee and you're going to be sliding your heel up towards your bottom. Slide it as far as you can while the pain is tolerable, and then extend it back down. Now sometimes right after surgery, again, it can be very painful. The knee can be swollen and it can be a little bit hard to do this exercise. If you find you're having difficulty doing it, one thing that I like to do is have a patient use either a strap or a belt or a towel, anything. Put this underneath the knee to give it a little bit of support. You're going to be holding on to this, and you're going to do that same exercise, a heel slide, but you're going to be using your hands to give it a little bit of extra push. Yep. Again, with these exercises, they should be slow and controlled, and focus on taking it back as far as you can within tolerance. Good. Perfect. One last exercise that I really like to help get back your knee bending or flexion after surgery is what we call a wall slide. Now to do this, I'm going to have to scoot the mat a little bit closer here. So pretend this is a wall. We're going to have Wade lay down here, and if his left leg is the leg that we're working on bending, I'm going to have him bring his leg up here. Go ahead and scoot your rear end close. So you want to get to the point right where you can just rest that foot on the wall. And now with this exercise, if you feel comfortable with it, you can just slowly slide that leg down the wall. However, if you're a little bit nervous that it might fall or it's starting to be painful, one thing you can do is you can use the good leg underneath to kind of help guide it. And you can see where Wade is right now. His rear end's kind of far away from the wall, and that's okay to start out with, but as your motion progresses, you're going to want to scoot your rear end closer to the wall. And so the closer you are to the wall, the more your knee is going to have to bend as it goes down. One other little trick you can do, if you say you get to about this range and it's stuck, instead of having the right leg behind the knee, you can have it on top of the leg to give it just a little bit of overpressure to push it down. Good. So those are a few simple exercises to work on getting your straightening or extension and your flexion or your bend back. Okay, now we're going to go over a few simple strengthening exercises you can do following a knee surgery. Now, the number one muscle that we're concerned about getting back and working properly after a knee surgery is your quadriceps. Why that's important is because these quad muscles are the muscles that help extend your leg. So if you're walking and it feels like your leg is giving out, it's probably because those muscles are weak. They're also the muscles that help stand up. So it's very, very important that these muscles come back and start to function properly as soon as possible after surgery. One simple exercise to initiate that is one we call a short arc quad. And to do this, again, we're going to use a bolster. If you don't have a bolster, that's fine. You can use a towel roll or pillow, whatever you have handy. But you're going to slide this under both of your knees, okay? And with this leg, the left leg here, is what you want to do is you're going to push that knee down into the pillow and you're going to lift the heel up until the leg is all the way straight. And you can see the quad muscle firing nice and tight there. As you do this exercise, you should feel this pull up all the way through your thigh muscle. And go ahead and relax. Okay. And then go ahead and bring it back up. Good. And again, with these, you want to hold this for a count of about 5 seconds, making sure that you have that muscle tight, nice and tight. You feel that pull through the kneecap and through the thigh muscles. Good. Go ahead and relax. Good. I'll slip this back out from under you. Another simple exercise you can do, go ahead and put your legs flat, Wade, is just a simple quad set. And a quad set, when we say set, we just mean a contraction. So really not a whole lot of motion is taking place on this exercise, but what you're doing is you're tightening the quad or your thigh muscles. So on this muscle right here, I often tell patients to pretend like, I'll slide my hand under there to begin with, or even put a little pillow or something and say, try and squish my hand with your knee. So as you do that, he's going to be pushing his knee down into my hand. These thigh muscles are going to tighten, and it's going to contract that quad muscle and help it wake up and start working again after surgery. These also you want to hold for about 5 seconds. The next exercise we're going to go through is a simple straight leg raise. And to do this, we're going to have you bend the opposite leg so your knee is bent and your foot is on the floor. And then we're going to do that quad set where you tighten the thigh muscle, and then you're going to lift the whole leg up slow and controlled all the way up to about the height of the knee, and then bring it back down nice and slow. This one isn't as important to hold as it is to have the motion be nice, slow, and controlled. We'll do one more. Now, one thing that can happen with this exercise, especially right after surgery, when there's still a fair amount of pain and swelling, is that this muscle isn't going to work quite the way we want it to. And when that happens, you get what's called an extension lag. So if Wade had an extension lag, he'd start to lift his leg and he wouldn't be able to lock it all the way. It would be kind of shaky. If that's happening, you're not ready to do this straight leg raise. You're going to end up using more of your hip flexors, and so you really want to focus on those other two exercises of the quad set and the short arc quad to get that leg firing.